Hello, today I will be discussing the chemotherapeutic drug Methotrexate. I'll be going over the mechanism of action, some pathways it interferes with, along with some of its major side effects. So to begin with, there are many classifications of chemotherapeutic drugs. We have alkylating agents, antimetabolites, those that target microtubules, antibiotics, and many more. Methotrexate classifies as an antimetabolite, so its basic definition is a substance that interferes with the normal metabolic process within a cell, typically by combination with enzymes. Methotrexate is used on a variety of cancer types, such as head, lung, skin, and breast cancer. It's also used in the treatment of autoimmune diseases, including rheumatoid arthritis. So since I mentioned methotrexate was an antimetabolite, it interferes with folic acid, making it an analog of folic acid. Folate was discovered to be vital to many cellular processes, and methotrexate behaves to disrupt this. The end result is impaired DNA synthesis in the S phase of a cell cycle. The main enzyme of importance here is dihydrofolate reductase. It inhibits both di- and tetrahydrofolate dehydrogenase to prevent the formation of tetrahydrofolate. Tetrahydrofolate is important to us because it's necessary to synthesize thymidylate, and that is an essential component of DNA. Tetrahydrofolate plays a role in methionine metabolism and purine synthesis of deoxythymidylate. So methotrexate will inhibit dihydrofolate reductase and interfere with purine and pyrimidine synthesis. Another interesting thing is that it leads to the accumulation of adenosine and adenylate, which exhibit anti-inflammatory effects upon binding to its necessary receptors, and that's why methotrexate is also a drug used for rheumatoid arthritis. When we try to think about how methotrexate interferes with different pathways, we have to think about the cell cycle. Cancer cells no longer have the normal checks and balances in place to control and limit cell division. The process of cell division, whether for normal or cancerous cells, is through the cell cycle. The cell cycle goes from resting phase through active growing phases and then through mitosis. Antimetabolites are cell cycle specific. They attack cells at very specific phases in the cell cycle. Antimetabolites are classified according to the substances with which they interfere, and on the right we can see that methotrexate interferes with the S phase of the cell cycle. Antimetabolites disrupt nucleic acid synthesis by interfering with the production of a major nucleotide or by substituting for that natural metabolite. Like most cytotoxic anti-cancer agents, antimetabolites are also toxic to normal cells, especially those in the bone marrow and the GI tract. After folate was discovered to be vital to many cellular processes, it seemed like a really good target. They also form a family of cofactors based on the structure of folic acid. Methotrexate exerts its chemotherapeutic effect by being able to counteract and compete with folic acid in cancer cells, resulting in a folic acid deficiency in the cells, leading to their death. Because the most rapidly dividing cells in the body, which are the cancer cells, have the greatest need for the synthesis of DNA, the cancer cells are the most vulnerable to attack by methotrexate in comparison to our normal dividing cells. Cancer cells need to make and repair DNA so that they can grow and multiply. Methotrexate will stop the cells from working properly. Unfortunately, it will also stop some of the normal cells, causing side effects, which I will discuss in the next slide. Some of the major side effects that are commonly seen with methotrexate include low white, red, and platelet blood cell counts, hair loss, mouth sores, difficulty swallowing, diarrhea, liver, lung, and kidney damage. When we think about how methotrexate works, we know that faster dividing cells are bigger targets, and I mentioned that cells in the GI tract are some of those nonspecific targets simply due to their rate of cell replication. As a result, when we read side effects such as nausea, vomiting, upset stomachs, or stomach ulcers and diarrhea, we can make a link as to why this is occurring. The liver is also one of those big targets because when there's a buildup of adenosine, which I spoke about in slide 2, it causes a buildup of scar tissue in the liver, and that's why physicians will often tell patients to avoid alcohol in order to limit the risk of liver problems. We also know that epithelial cells are among the fastest to replicate. We are constantly shedding and renewing skin cells, and that's why hair loss is commonly associated with this medication. A lot of patients will also suffer directly from ulcers or sores in the mouth. On the bright side, there is a follow-up treatment after methotrexate has been administered. After 24 hours, folinic acid, also called calcium folinate, is given to the patient, which will bypass the action of methotrexate, allowing normal cell division to carry on in hopes that the normal healthy cells will recover faster than the cancer cells to prevent chronic side effects. We all know that the aim of chemotherapeutic drugs is to progressively shrink the cancer over several cycles of chemotherapy, allowing healthy, normal cells to recover in between. A question of interest that I have for this class is that in addition to methotrexate being a treatment for cancer patients, it is also a treatment for rheumatoid arthritis. So would high doses of the drug affect bone growth or healing after a bone fracture?